back with nurses because all said and done, the doctor may come prescribe medicines or come at certain key points and go. But during the rest of the hours, it is you people, all of you, who take care of the patient, who ensure that you are there, who see those concerns which a doctor may not even notice and bring it to the notice of the doctors and the other team members. So firstly, I would like to thank each one of you for the wonderful work which you are doing as nurses. And now I'm glad that you are taking it a step further to see that, to supplement the work which you already do. What is it that you can add to your practice on a day-to-day basis? That is exactly where principles of palliative care comes in. And the topic of today, pain, is the bread and butter of any person who wants to do anything to do with palliative care. But suppose even if it doesn't end up being your bread and butter, as in you don't earn much out of it, I'm sure that you will earn the love and respect of your patients if this one aspect, whatever we go through in today's session, if you can take care of it for the people whom you will be caring for. So before we start off, I want everyone to be as active as possible. Otherwise, it gets boring for me. So I'll be asking questions in between, simple questions which even school children can answer. Okay, so I want you to be active. For those who wish, you can unmute yourself. But if you're too shy, even after growing up this much, then you have the option of chat boxes. Okay, so you ensure that you use the chat box so that I'll keep looking at the chat box in between and respond accordingly. Senior, shall I start sharing my slide? Just a second. Is it visible, Senior?
Visible, doctor. Just go for the, yes, please.
Yeah, is it fine now?
It's fine now, here.
Okay. Just a second. My chat box is not visible, right? Only my PPT is visible, correct?
Yes, your PPT is only visible, no chat box.
All right, fine. All right. So, yeah. So introduction to pain. Firstly, let me ask you, what does pain mean to you? The questions start right away as soon as we started the session. Can some of you unmute yourself and answer just randomly? What does pain mean to you? If you don't answer, I can even start taking names and ask, but it's better if you just participate as a volunteer. Yes, Sister Leela Kanti. Yes, please.
Extreme discomfort.
Extreme discomfort. Dr. Sister Aradhana.
Discomfort.
Unpleasant stimuli.
Body discomfort and no.
Body discomfort.
And uneasy.
Unpleasant stimuli.
Uneasy stimuli. Sister Ashwati says unpleasant stimuli. Okay. Sister Swastika says unpleasant stimuli, sensation that is unpleasant and causes discomfort. Okay. Does it necessarily have to be physical? Only if somebody touches you, or only if you are poked with something, or if something else is happening inside your body on a physical level, only then does it pain, or does it pain otherwise also? Are there situations in your life which has pained you?
Yes.
Sensory.
Sorry, Sister Aradhana, what did you say?
Sensory, sir. Sensory.
I didn't understand. And anxiety, did you say?
No, sir. Sensory.
Physical, emotional.
Okay. So all of us agree. Okay, Sister Sujita says psychological. Sister Harita says tingle, uncomfortable feeling. Okay. Now let me ask you something. If something wrong is going on in your life, okay, apart from any physical discomfort, something wrong is happening, something which you think shouldn't have happened is happening, or you see something like someone else going through it, do you feel some pain within yourself? In Hindi movies, the hero always says dard dil mein dard, pain in my heart. Doesn't mean he is physically having some pain, but certain situation is happening around him because of which he is having some pain. So all this was just to tell you that even if a person doesn't have physical pain, right? Even if some certain situations, it may be psychological, something is going on within his mind. It may be certain social factors. Suppose it is a person who just got diagnosed with a disease. He is wondering how he can take care of his family. If he may lose his job or something like that. It may be spiritual factors. I have always been a person who has done the correct things in my life, but now something wrong is happening with me. Lot of factors can be a cause for pain in a person. So firstly, now that we are stepping into the world of pain from a palliative care perspective, one thing which we need to understand is we are no longer limiting ourselves to physical pain. Yes, physical pain definitely is something which we have tools to address. But many a times, once the person is out of our OPD or IP, right, we don't bother about what else is happening in that person's life. And those are exactly the factors which influence pain in a person. It influences to such an extent that it will cause an effect on their physical symptoms as well. That means physically also they may have pain, or whatever pain may they already have, that may aggravate or worsen if the other dimensions of a person is affected. Is everyone able to follow me? Come on the chat box and respond. I just want to know if everyone is able to follow, if the pace is okay, if my audio is clear, or if there is any comments you want to make so that I can make corrections as soon as we go, as we go forward. All right, yeah, keep responding like that. Thank you. What about this person? Do you feel this person is in pain? Come on the chat boxes, or you can just reply. I mean, you can unmute yourself also. Does this person appearing to you, does he appear to be in pain?
He is not a he won't feel pain, sir. Why means he is already in spiritual devotional mood now, so he won't get pain, I think.
Okay, Sister Sujita. There are a lot of people who are agreeing with you, and there are a lot of people who are disagreeing with you also. Some are saying yes, some are saying no. Now, this is something that it's little confusing to the mind. When you look at him, you feel, oh my God, obviously this person is going to be in pain, right? He has poked himself through different holes and created new holes also on his face. But surprisingly, these are people who, due to some situation which they are in, some sort of a mindset which they are in, like sister said, something to do with their own spirituality. We all have our own definitions of it. That is okay. But something which this person believes in it so strongly that he's able to go through the process without having much pain. But just imagine somebody, even many times adults, who come and sit for blood draw, okay, or are supposed to get an IM injection. Have you seen the faces which they make many a times? Different kinds of faces and sounds will start happening. Just one needle, that too designed, a needle which is designed to cause minimum pain when it is given to a person. When that kind of a thing is used, still they are worried and they feel pain. So basically, there are many factors which can influence a person's pain. So sometimes his mindset is in a particular way. Sometimes what we are doing to him is not supposed to cause pain, but still it causes pain in him. So what do we do now when somebody says that they are in pain? So for us, I mean, like many of you told, there are already some definitions of pain. It's an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Basically, now we are going to stick to a person who is having some sort of a disease, right? Some sort of a disease process within his body, because of which that person is getting pain. But there is one more thing which we need to do. Now that we are going into the world of pain and palliative care, pain is what the patient says hurts. Robert Wycross is one of the gurus of palliative care. And he says that if a patient says that it pains, then you have to agree with him, because every person is different. It is not the way we may perceive it. For us, we may think that, just by pricking this much, how can he act so much? This guy is definitely acting. We may feel like that, but for the person who is undergoing that suffering, definitely it may be something true. So if all said and done, if a person says that there is pain or he's having pain sensation, for us, we'll take it for granted. No more extra doubts on that matter, whether it is paining for him or not. So why is pain control important? Anyone wants to answer? Is it pleasant to have pain? So suppose in your body there is pain at some point, somewhere on your little finger. This little finger, this tip of the little finger, we don't use much, not used for anything as such, right? Your little finger, the tip of your little finger, we don't use it. These fingers, yes, we may use a lot, these four, but the tip of your little finger, we may not be using much. Suppose there is some cut over there or some problem is there and it is causing pain. Will you be like, okay, no problem? Why? Anyways, that we are not using the tip for anything, let it be. Is that so? Okay, Sister Sarah says pain impacts everything. Yes. Sister Sushma says to provide comfort to the patient. Yes. To alleviate suffering. Yes. So what I'm trying to say is, even if you're any small millimeter of your body, if there is some issue happening over there, it may be a small injury like a needle prick, or it may be something else, an ant bite or whatever, your body demands attention to that point. Yes, true for everyone, right? None of us have reached a point where we can ignore that pain yet. So let's look at this. Why is pain control important? One thing is, it is the most common feared and debilitative experience of patients, especially of patients in palliative care. Always we try to save ourselves from pain, right, sisters? All of us in our life, whether it is physical pain or emotional pain or some other form of social issues which may happen, which may cause us pain, always we try protecting ourselves from it, right? So pain is a feared and most debilitating experience for not just patients, for everyone. But in palliative care, we'll be dealing with those kind of people who have physical ailment as well, who have an underlying medical condition as well, which is causing them immense pain to the point that many of them want to kill themselves also. Pain is a constant reminder of the illness. The person is constantly reminded that he is having an illness. Changes in the pain may indicate progression of the illness or a change in the mechanism of pain. Sometimes the pain is acute. Acute means it has just been small amount of time since it started. And sometimes the pain may increase to such an extent, if the pain is not handled on time, then it may become a chronic pain. And a pain which was there only at the tip of the little finger may spread towards the whole upper limb. Okay, it is possible that today the tip of your little finger only is paining, and you ignored it for next 3-4 days. And after that, you suddenly notice that your whole arm till your shoulder starts paining. It is possible your chest and your other side of your arm may also start paining. I want you to know that there are studies which have shown that osteoarthritis knee, have you heard of osteoarthritis knee in elderly people? It is very common. Okay, as all of us are growing old, one day our bones will start wearing off, joints will start wearing off. Even if there is osteoarthritis knee in one knee, suppose on my right knee I have got osteoarthritis and it is causing me pain and I don't treat it, I don't get any help, it is very much possible that over the period of next few days or months, my opposite knee also starts paining, or both my lower limbs start paining, even if pathologically there is pain only at my right knee. This is something which is being proved now. So similarly, there is possible that pain becomes chronic. And like one of the sisters said, pain prevents people from attending to other issues and developing positive meaning in life. It impacts each and everything. You want to do things for your children, you want to do things for your family, you want to do things better at work, for your friends, but there is some pain which is happening and then you just can't pay attention to anything. What you need to do is first you need to address the pain. Only then can you do whatever else you wish to do. Coming to time factor, this is what I was trying to explain. Here you can see there is a peripheral nerve. Peripheral nerve means a nerve which is going to the peripheries of your body. And you can see this written as dorsal horn. Dorsal horn means it is something which is there inside your spinal cord. Now, if the stimulus is constant, you continuously, there is stimulation, the same pain is continuing as time passes. The question was, does the pain remain constant, or will it decrease, or will it increase? So this is what I just explained, that the pain can gradually, as the days go by, it can increase. So even if some patient after many days, he may come to you and say that initially the pain was only here, now my whole arm is paining, you don't think he is bluffing. There is a mechanism for it. And it is also possible that a person can develop whole body pain. You ask the person what is happening and they'll say, my whole body is paining. Is somebody trying to ask something? No. All right. So the whole body can start paining. Okay. So what happens is, suppose at one point of time, there is only one nerve which gets affected. So you have only that much pain. But as you ignore this nerve, what it starts doing is it will start calling its neighboring nerves, its neighboring friends basically. Okay, can we, if somebody is asking something? Sinya? Yeah, just mute the person. Right. So initially there might be just one nerve which is affected, and now you ignore the nerve. You're like, you're just one nerve, I don't want to pay attention to you. So what this nerve does is it will start releasing some chemicals and it will start influencing its nearby friends, that is the nearby nerves, and it will start recruiting them. Hey guys, pay attention, I'm not feeling well. Okay, can you guys also make some noise? And what the neighboring nerves do is all of them start giving the pain signal. So slowly the person starts feeling more and more pain from more and more area. Initially it was just at the fingertip. Now it is spreading to your arm. Now it is spreading to your upper arm. Now it's spreading to your shoulder. Now it's spreading to the chest, till the time you pay attention to the nerve. Okay. This mechanism is called as recruitment, or something called as central sensitization. We are not bothered about the technical jargon of it right now. I just want you to know that if a person comes to you with chronic pain, it is very much possible that the pain was initially localized, but later on has become widespread. Okay. So what are the types of pain? Again, I told you there is a peripheral nerve which comes to the peripheries of your body, and there is a connection to the central nervous system, that is to the spinal cord and then to the brain. So any stimulus which happens at the nociceptive level, let me just try getting the laser. Yeah. So anything which is happening at the peripheral level, any stimulus which is coming from here is called as a nociceptive stimulus or a nociceptive pain over here. Nociceptive means pain generating. And anything which is happening, anything goes wrong at the level of the nerve, the whole pathway of the nerve. See, I'm tracing it with the laser along the nerve or in the spinal cord or in the brain, anything which happens along this pathway from the periphery to the brain. If there is a pathology in this area, then we call it as neuropathic pain. Okay, so there is nociceptive and there is neuropathic pain. What does nociceptive? In nociceptive also, like you already saw, it is coming from the periphery, right? So there are different possibilities. One is on your skin surface and one is within the body, within the body, that is in the connective tissue also it is possible, from the muscle level also it is possible. All these places have got peripheral, are in the periphery, and they have got peripheral receptors. So these kind of pain are called as somatic pain. Please mute yourself, whoever is by mistake unmuting themselves, unless you want to share something. So stimulation of peripheral receptors at the skin, muscle, bone, or connective tissue. Okay. Now here, whenever there is some problem in these areas, the person can usually localize it. You can ask, where is the pain? Can you show me with one finger? And they will point out, yes, doctor, the pain is here, or the pain is somewhere on your foot, or something like that. They'll be able to clearly localize it. Okay. They may describe it in different ways as a aching or a gnawing pain. And most of the times they respond to simple analgesics. Just give like an acetaminophen or a paracetamol. They respond to simple analgesics. And if it doesn't subside with analgesics, you can try opioids. Some of them are sensitive to opioids as well. Now, the other kind of nociceptive pain is visceral pain. Okay, what does viscera mean? Can come on the chat box. What does viscera mean? Organ pain, layer, organ. Yes. Liver capsular pain. Yes. We have 38 participants, at least 10 responses should come, correct? So internal body pain. So yes, I think you got the point. Visceral pain means it is something which is happening inside your system. It is amongst the organs. You're not exactly able to tell where it is or what exactly is happening, what is the location. So whenever there are a lot of organs in your thorax and your abdomen, whenever there is some infiltration, okay, or compression or distension happening inside your thorax or your abdomen, you may feel a vague pain. You're not able to tell where is it paining. I can just feel it in my abdomen. I'm not sure exactly where it is. Is it my stomach? Somewhere, you may say somewhere on the right side, I can vaguely feel. And they describe it in something like it's like a deep pain. It's like a squeezing pain. I feel like there is some pressure which is happening. It's like some continuously aching kind of pain. I'm sure all of you know referred pain, right? There is something happening near the diaphragm. And where does the person tell the pain is? Again, can you come and tell? If there is some pathology or some disease happening near the diaphragm or at the diaphragm, where will the person say that there is pain? The clue is referred pain. So the person tells that the pain is in the shoulder, at the tip of the shoulder. They'll say that there is pain at the tip of the shoulder, but the problem is in the diaphragm, that is between the abdomen and the chest. So referred pain, this is called as referred pain. Many times a doctor refers a patient to some other doctor, right? Just like that, the problem is there between the abdomen and the stomach, abdomen and the thorax, and the pain is referred to the shoulder. So this is called as referred pain syndromes. There are different kinds of referred pains. May be associated with nausea or vomiting because the GI tract is involved. These kind of pains are usually very opioid sensitive. That is, you can use opioids for their treatment. Now coming to neuropathic pain. Neuropathic pain, as we already told, this is related to the nervous, the pathway of the nerve. Okay, from the periphery to the brain, till that point, what it reaches in that pathway, if there is a pathology, then we call it as neuropathic pain. So this is usually like a constant ache or a constant pain with, they may have some dysesthesia, which is just a technical jargon for abnormal sensations. These abnormal sensations, as far as it is neuropathic pain, it is called as, it is described in different ways. They may say pins and needles sensation. You know, many a times when you have sat in one position or slept in one position for a long period of time, and then you just release that area, initially what you feel is the whole arm or your whole leg has become numb. But what happens immediately after that, over the next 2-3 minutes, once that numbness is relieved, how do you feel? Again, come to the chat box or unmute yourself. What happens once the numbness starts getting released? Right. Exactly. Yes.
Some light feel we will.
Yes. Initially you feel,
light.
yes, feeling of lightness, feeling of numbness. And after that, you will start getting like a thunder, right? A thunder like pain, pins and needles coming, keeping on pricking at each and every point, right? At each and every point of that limb will start getting tingling sensation, pins and needles. Yes, absolutely. Yes. So just like that, abnormal sensation starts happening, pins and needles sensation, tingling sensations. Many times people may say burning sensation. These are all descriptions of neuropathic pain, right? In neuropathic pain means somewhere the nerve is affected, the treatment approach is slightly different. That is why we need to look at it. Allodynia means a pain from a stimulus that would not normally cause pain. Have you had any patients who would say that they can't bear putting the blanket on them, because if the blanket or the cloth touches their skin, they'll start feeling pain? Have you had such experiences? Anyone? So they may just be wearing their usual clothes, and then they'll start saying that they have got severe pain. Right. I recently came across somebody who is working as a security officer in a state called Tamil Nadu. She constantly feels burning sensation over her body, and her only sorry, somebody is said something. Video is not.
So that syllabus is not showing.
Is somebody else facing the same problem? Is my slide visible?
Not visible, sir. Actually, the slide is visible from my end, sir.
Okay, some of the participants, can you just respond? Is the slide visible?
It's not visible for me.
Okay,
It's visible
sisters.
to me, sir.
Okay, Sister Sangeeta, I think you just need to swipe the screen. I think you are on you are seeing the videos of other participants probably right now. You just need to swipe the screen towards the left, from the left to the right. Just try it out and see. You will reach a screen where only the slide will be visible.
So it's not coming.
Sinia, can you just help her out?
Yes, doctor. Please continue. I will message her.
Yeah, just message her and help her out. Yeah. So Sister Ji, don't worry. More than what is on the slide, I'm explaining more than what is there on the slide, and I'm making it as simple as possible. I'm sure you won't need the what is written on the slide. So when you get it sorted, just as you get it sorted, just pay attention as well. So this pain which we say is like, just on the touching of clothes or something, is called as allodynia. So I was telling you about the security officer who feels like her body is on fire, always like on burning sensation. She always keeps her clothes wet, otherwise she can't stand it. This is the condition in which somebody referred her to us. She has been having this since many years, and she wears only wet clothes. Just imagine the situation. So this is a case, extreme case of allodynia, or of neuropathic pain. So this is also described in different ways: lancinating, sharp pain, shooting kind of pain, flashing, feels like electricity is passing. And many a times, in some patients who have unfortunately lost a limb, they may still feel pain in their limb which has been separated from their body, which is called as phantom limb pain. These are all examples of neuropathic pain. Usually they follow a clear nerve distribution. You must have learned in your anatomy that there are nerve innervation is there throughout the body. So wherever the pathology is there, the pain will be following that same pathway. So you can localize it. Now, what do you do in a person who cannot express pain? Many a times you will be coming across patients who are so debilitated, or they may have some some issue with the vocal cord due to some cancerous illness which has spread everywhere, or some issue in the brain because of which they are not able to respond to you. In such patients, how do you know pain, whether they are in pain or not?
By seeing their facial expressions, we can identify, sir.
Okay, our most active participant till now, who's unmuting herself every time she's getting a chance, Sister Sujita. Thank you.
Yes, sir.
Other people, do you want to respond? Michael, brother Michael. Brother Michael is very chilling and enjoying listening to the class. Do you want to unmute yourself and give in some inputs? Somebody who is not able to talk, how do you think that they will show pain? Yes, sister, come again, Sister Sangmo. Okay, pain scale. You're assessing pain scale. You use a pain scale to assess. All right. All right. So let's come. I think many of you have children probably, or must have seen children, at least if you don't have your own. Even if they are not able to express or verbally tell, what do they do when they get pain? How do you know if a child is in pain or not? Okay, many of them cry. Little older children may not cry, but then they may make some facial expressions, or they may try to withdraw whichever part of their body is affected. They may not, yes, facial expression, irritation, irritable, and they will not allow you to touch that part of the body which is paining. Similarly, even if a person who is due to certain reason is unable to express through words, they have different types of responses. With facial expressions, they may make some noises, they may have some particular body movements, there may be a change in their interaction with you, their routine changes. For example, they may say they don't want to eat food, or they may refuse to eat, and they may, like you said, crying, mental status changes. They may show irritability, crying, confused appearance. So even in a person who is unable to respond, you will come across such people who are terminally ill, who are unable to express themselves due to very many reasons. These are the things which you have to look into. With this, I'm going to come to you with a story. It's a true story of a person who has been with us, who had come to us a few years ago. Let's call him Mr. A. He was diagnosed with a cancer. It was a head and neck cancer. He's on disease modifying treatment. That is, he's taking some chemotherapy and radiotherapy, things like that. He, from the cancer center, he has a wife and 3 children. He has got an elderly mother. Now, as you can see from the hand, the way he has kept his hand, it's a very typical scene which you can see many a times in people with head and neck cancers. They will be sitting or presenting to you like this. Now, what do you think this person will be going through? Is it the physical? So I just want you to know, like physiologically, it's the head and neck region is richly supplied with nervous tissue. Lot of nerves. You remember cranial nerves is there, right? The cranial nerves. It is all coming around from this region, and the whole head and neck region is richly supplied with nervous supply. Now, when a person is having that much rich nervous tissue, any small issue, small stimulus, small injury, small disease happening will also cause immense pain. If you have a headache, okay, if you have a headache, on such days, don't you become a headache for your patients and for your doctors? I'm just saying, many a times, even when the doctor comes with a headache, that doctor becomes a headache for the patients and the nurses, right? It is true, vice versa. Always it is true. Just like that, any small disease happens in the head and neck region, the person goes in severe pain. Okay. But when a patient comes to you, especially in countries like India, where we belong to lower middle class, lower middle income countries or lower income countries, where we see widespread poverty. There are a lot of other factors which aggravates the pain for a person. So what was the things which was bothering this person? Mind you, many of these things which I'm going to share now came out in discussions with nurses. Sister Ashwati, did you raise your hand for some purpose? Okay, you have lowered your hand again. Okay, fine. Okay. Many of these things start coming out when you spend some time with the person. And in palliative care settings, or even in otherwise, the doctor may not have that much time, or he may just say, okay, what is the issue right now? And the patient also wants to respect the doctor's so-called time and tell that I've got pain here. That's the only thing he will tell. He will not tell much anything else. But when you go and start spending some time with the person starts to open up. So what are the things which he's thinking? He's thinking that, will I be able to pay my medical bills? How will I provide for my family in the future? I'm not able to do anything right now. I'm so debilitated. I don't want to eat or talk to anyone. I don't feel like I'm not in a mental state. It's so much paining. There is too much pain. I'm unable to sleep because of this pain. Am I going to die now? There is so much pain. Am I going to die? Is this disease going to go? If my time comes, or if my time comes to an end, who will provide for my family? Who will take care of my kids? These are all practical issues which people think of, whether they have an insurance or they don't have an insurance, or no matter what is happening. These are all practical issues which people come with and they want solutions to. And mind you, each and every of these questions adds to the pain of the person. And as you find solutions to each and every of this problem, the person's pain also starts coming down to such an extent that many a times you may be able to reduce the dosage of medicine required as well. Have that in mind. Right. So this is what we were trying to say. There are physical aspects to pain, psychological aspects, socio-economic aspects, and spiritual aspects as well. This is what we call as total pain, right? Pain means not just physical, but total pain. All dimensions of a person needs to be addressed. So illness related pain is much more than just the physical distress. The first question which we began the session with, what does pain mean to you? pain also means that there is something beyond physical, dimensions beyond physical, which is getting affected and which is causing distress. So influences on pain perception, like you said, there are other physical symptoms. Yes, there may be, the person may have nausea and vomiting, the person may have itching, the person may have breathlessness. So there are other physical symptoms as well, which will worsen a person's pain. Social issues, cultural issues, spiritual aspects also. Remember the guy, the second picture, the first image I showed you, the guy who is put on all needles across his face. Cultural and spiritually, he is doing fine. Physically, and that has an influence on his physical perception of pain as well. Now coming to something which is extremely important for you, for everyone, but especially for you, because the doctor, again, like I said, will tell, okay, Sister Ji, give 650 milligrams of paracetamol or acetaminophen 3 times a day, and the doctor will go home. But when you are taking duty, during your shift, every 5 to 10 minutes, the patient will call you, will bother you, right? Sister, the pain is not relieving. Sister, the pain is not gone, right? So when you are going from one patient to another, again, you have to go back to somebody because of inadequate pain relief. Your time gets absorbed over there if there is incomplete pain relief for a person. And that is exactly why, if not for the patient's sake, at least for your own sake, so that you have a stress-free, shift. For that, at least you need to know how to assess pain properly. And then you can inform your team. As you know, in palliative care, it is always a team approach. It is never a one-man show. So there is always something to contribute from your end to the treatment of the person. So we already described few scenarios till now where there is somatic pain, there is visceral pain, there is neuropathic pain, and the person may try describing it in different ways. So you already have an idea. But now you want to, in general, assess pain, how much pain the person is in. So there are certain ways to do it. The first step is always build a relationship. Introduce yourself. Ask about the person. Also, know about their background. Listen actively. Listen in such a way that you are conveying that you care. There is no need to say that I care for you. There is no need to say that. Just the way you're asking questions and just the way you're listening will convey that you care genuinely for the person, and you're not doing it just because you are a nurse over there. And many a times we tend to say that, don't worry, we'll take care of the pain, everything will be fine. Never ever say that, because we don't know to what depth the illness is there. What are the what are the dimensions of pain this person has? Just say that you will do your best to address the situation. Okay. So that's the first step. You build a relationship, following which you need to look into various dimensions of pain and document it. So what is the cause of the pain? You need to know, is there a diagnosis for it? Most of the cases in palliative care, unlike in the usual medical settings, they don't come in acute stages. They are somebody who have been having a diagnosis and the disease has been there in their system for some time, or they have been diagnosed with it, and now they are coming to you. So you know what the cause is, most likely is. What is the duration? Does it affect their sleep? And does it affect their activities of daily living? With this pain, are you able to do your household work? With this pain, are you able to do your job, etc.? So ADL means activities of daily living. That is going to the toilet, doing some kitchen work, doing your home works, and things like that. For ease of remembering, there is certain mnemonic which you can remember. PPQRSTU. Okay, so PPQRSSTU. So what is there? Is there any palliative factors? That is, any pain relieving factors. So somebody says, doctor, when I lie down, the pain is less. When I'm sitting in a crouching position, the pain is less. If I don't raise my arm, the pain is less. Is there any provocating factors? When I move, the pain is there, right? Or when I am lifting weight, the pain is there. What is the quality of the pain, which we have seen already? We'll be seeing later also different qualities for different origins of pain. Is there any radiation? Is the pain only at one side, or is the pain starting from the back and going through to the foot, through the lower limb? What is the site of pain? What is the severity of pain? This is self-explanatory. Temporality of pain means what is the timing? Is the pain more evening hours, during morning hours? And unwheeling. Is there any factors because of which the pain increases? So these are all factors which you need to look at for when you're assessing pain in general. Okay, now we were looking at quality of pain. So quality of pain is where they describe it in different ways, which may give you an idea that the pain is what kind of pain is it? Is it a somatic pain? Is it a visceral pain? Is it a neuropathic pain? And I'll tell you, in majority of the cases, many a times the pain is mixed. That is, there may be different components of it, and you may have to give different medications, or you may have to supplement them with different kinds of painkillers, so that the different variety of pain which is there. Some may have somatic plus neuropathic, some may have only nociceptive, some may have only neuropathic. So depending on the kind of pain, you may have to play with the medications or play with the drugs. So this is where quality of pain becomes important. And this is also where your role comes in, because many a times they may not be able to describe it within 5 minutes. Okay, so you may need to sit with the person to understand exactly what kind of pain is there and what are the dimensions of pain. I've been repeatedly telling. Right. Is everyone clear till now? Please come on the chat box and respond. Are you all able to follow? Is it too fast? Is the language okay? Is the sound okay? Are you all able to understand? Is there anything which you want to ask? All right. Thank you for the responses. So now how do you, there are certain scales, there are certain pain scales which you can use for measuring pain. Very simple, self-explanatory things. It's a verbal description. Okay, verbal description scale where the person says there is no pain, mild, moderate, severe, or excruciating, different severity grades. All right, this is called as a verbal descriptor scale. There's a numerical scale. This is very commonly we use. I personally use this many a times. So what is being asked is, you will say that how much pain do you have on a scale of 0 to 10. 0 means no pain. 5 means okay, you can manage the pain. 10 means it's unbearable, you're not able to sleep or do anything because of that. So this is called as a numerical rating scale, and you will ask them how much is it out of 10. So they may say 3 on 10, 7 on 10, 10 on 10. Some people may say even 20 on 10. That means it's that severe, so severe for them. And how you can, one of the things is, all these scales you can use is when you are giving medications, after some time you want to reassess, and then you ask now how much the pain is. They will say, okay, now the pain has reduced to 4 on 10. So you know, okay, the medicine is working. Visual analog scale. So you have images like this, right? Worst imagine, smileys, All of us, we are living in WhatsApp generation now. All of us, more than talking, we send smileys to show what state of mood we are in right now. So use of smileys basically, right, to describe the various modes which is there, to make it little more. Yeah. So you can see how it is. You're okay, you're doing well, you're not okay, you're worse, you're so bad that you're crying. This particular scale where the faces are there, it's also called as Wong-Baker faces scale. It's a non-verbal rating scale. Okay, this is also used in children many a times because they can easily make out how they are feeling. This is a revised faces scale. Okay, so choose the face which shows how bad your pain is right now. Now here is something called as, there is something called as a body chart. Now, till now we were just assessing in general, how much pain is there. Now we want to be little more specific for documentation purpose. It is not always necessary that only you see the person, right? The next time the person comes in, there is some other nurse who is on shift, and that other nurse may not exactly know where the pain is or how the pain was. And many a times the written words may cause confusion because different people write in different ways. It may sometimes cause confusion. So a body chart is something which becomes much more easy for anyone and everyone to understand. So there may be different pains and different kinds of pain at different parts of the body. So here you can see the right upper limb. The right upper limb, there is the pink color, and in the hypochondriac region, there is a blue color. Two different kinds of pain they are, and that's why they have been shaded in different colors. Now each of this 1 and 2 you have to describe separately. The PPQRST which we mentioned, for each of this pain you have to mention the site, the radiation, the palliating factors, the provocating factors, the severity of it, the type of the pain, the quality of the pain. All this has to be described. So there is this body mapping which we do. So the front side is there, the back side is there. This is one way of doing it. You can also use different colors. If there is a color coding, if there is a color coding which you are doing in your setup, you can choose that. Black means it's a severe color. Green means it's a mild color. Blue means it's a moderate pain. Sorry, not color, pain. So severe pain, moderate pain, mild pain, have different color codes for it. You can also have different, different designs for different kinds of pain. When somebody says it's an aching pain, you can draw it like the one in the green. If somebody wants to describe a throbbing pain, you can put like a star. So when somebody is describing a shooting pain, you put an arrow in the direction in which the shooting is happening. So body maps become extremely important, right? Because anyone and everyone can easily understand it in one look. In one look itself, they're able to see. There's no confusion happening over here. Now coming to certain terminologies which you must know. So there is a baseline pain. The person is having this kind of pain all the time. Okay, the person is having this kind of pain all the time. Continuously there is pain. The last line in that baseline pain, in Chennaya's case, it is continuous pain felt over the jaw. That was one of the, Chennaya was a patient who had some head and neck cancer, and he was having continuous pain over the jaw. So that was a baseline pain. It can be continuous or intermittent, but always in the background, there is always a pain in my life. Then there is something called as a breakthrough pain. Okay, so in breakthrough pain is something which occurs on and off and is unpredictable. Sometimes, doctor, I'm doing fine, I will be lying down and suddenly there is a pain. Then you ask them, when does it come? On what activity does it come? He's not able to tell. Unpredictable. Anytime it can happen. Okay, some breakthrough pain which is happening. So in that person's case who had a head and neck cancer, there was some neuropathic pain which was happening on and off, but very severe. So it will need some additional medication. So that is called as a breakthrough pain. Then there is incidental pain. That is some precipitating factor. Many a times it will be on movement or on certain activity or some action which they are trying to do. A person with head and neck cancer, many a times it will be when they are opening their mouth, trying to eat or trying to speak. That is when there is pain. That is called as incidental pain. And then there is an end of dose pain. Every pain medication works only for certain number of hours, maybe 4 hours, 6 hours, 8 hours, 10 hours, 12 hours, depends on the medication. But once the duration of action of the medicine starts coming down, the pain starts coming back and the person knows that he needs to take his next dose. This is called as an end of dose pain. So when you're talking to your team, this is one way of putting it. Like you can say, sir, there is end of dose pain, there is incidental pain, there is background pain, there is breakthrough pain which is happening. So it becomes very self-explanatory. So what was done for Mr. A, right? How did we address his various dimensions of pain? So how did we convert total pain into total care? All these things we learned in theory during our training period, but practically doing it. So for the physical pain which we had, and something called as an opioid trial was done, in which morphine was used as a medicine. A trial was done to see if morphine is helping his pain, and physical pain was relief was given from that. Because of certain thoughts which he had, he needed some counseling. Not just him, his wife as well, because in palliative care, as you must have known by now, we always address not just the patient, but also the caregiver, also the family. So psychiatric consultation was facilitated. We don't have a psychiatrist. But we facilitated connected him to a psychiatrist whom we know. So that one thing is financially, not much money was taken from him and he was given sort of a priority. The doctor saw him on something like a priority. For socioeconomic aspects, we have some volunteers who want to do some good in society. There was volunteer-led sponsoring. They were willing to sponsor his education, his children's education. So he was worried that how his children will continue their education. So right now I am lucky that I'm able to work in an NGO where we have a lot of good willing volunteers who will take up these kind of projects, where they sponsor a child till the education is over, or till they get a job, or till whenever it is required. And so that his wife can have a source of income, a poultry business was sponsored. That is, they got the hen box, the hen cage and everything, and they got hen and then so that they get into the poultry business it's a small scale, not like a large scale, in a small scale. And for a spiritual crisis that he was having, we counseled him that he will be, so his concern was that he won't be able to do a lot of things. He won't be able to live with dignity in his life now that he is in a debilitated state. So we counseled him that once the other dimensions are taken care of, he will start feeling better, and with that he will be able to do to whatever his physical capacity is. He will be able to give back to his family and society as well. So this was a case of Mr. A where total pain, with the help of total care, was able to relieve up to a big extent. Of course, not all of it. At the end, we cannot expect such a person to be 100% okay, right? Because at the end of the day, there are issues which he has to face. The disease is not going to go away, and there may be certain, maybe death, which he may have to face in near future. So 100% will he become okay? No. But have you helped in adding quality to this person's life? Always remember, in palliative care, it is not about adding the number of days to a person's life, but it is adding life to the number of days which a person has remaining. This is what all of us are trying to do in palliative care. And you as nurses have to play a very huge role. A very big role is there for you to play in this. With that, I call an end to my presentation, open to taking questions. I think it's 4 o'clock on the dot.
Thank you so much, doctor. Thank you for that wonderful presentation.
So please feel free to unmute yourself. Always in learning experience, in learning, it is good to make a fool of yourself so that we learn, all of us learn. You don't have to be formal or sit uptight. Feel free, just like we all used to be in school. You may ask questions, you may ask doubts, you may make comments. No judgments, no conclusions. Feel free to post comments or unmute yourself as well. Even if it's not a question, if you want to make a comment about some situation or some patients whom you have faced, which was difficult for you, which was good for you, which you were confusing to you, whatever it is, feel free to share. I'll be more than happy to hear them out. Sister Priya, you had unmuted yourself.
Hello, sir. Hello. Sir, can you hear me?
But there is a lot of noise coming from your end, ma'am.
Yes, Sister Ashwati, you can just hold the mic close and speak out. Okay, meanwhile, Sister Sangeeta, you have unmuted yourself. Okay, that was my mistake. I mean, that was by mistake. I think everyone, once I call out
Hello.
names, you have a nice smile on your face. Yes, Sister Ashwati, please tell me.
Sir, shall I ask you? Sir,
Yes,
if
please.
a person is telling that I'm having a pain continuously, if he is telling, but we are not feeling that the person is having pain, what can we do in such a situation?
So this is exactly what we started the presentation with, that whatever the patient says is true for you, is true. That has to be our first assumption. Okay. And slowly, I think now over the next sessions, we'll be coming to what drugs which we use for management of pain. There is a step-by-step way in which you upgrade the pain medication. So if a person says they're always having pain, of course, you need to assess the pain like the way you have seen right now. Assess the pain thoroughly and not just the physical dimensions. Yes, the physical dimensions you have to assess, PPQ, RSSTU, this much you have to assess. But beyond this, you need to see what are the other dimensions. I know that in a setting like in India or where the population pressure is so much high, okay, in such situations, there may be, you may not get enough time. But this is where you need to have people like volunteers. You need to have more mechanisms in place where people who have more time, but they may not necessarily need to be a person from a medical background. You know, many people who work in medical schools, there are medical students who have much time. They need to take a case for presentation. So you hand over things to them. Always work in collaboration. In official capacities or unofficial capacities, it is always going to benefit the patient. So for the sake of the person who is coming to you for care, always work in collaboration with those around you. Have innovation in your mind. It may be simple solutions. You know, somebody, you can even ask the caregiver to explore. You can, to explore what are the other dimensions of pain. Doesn't require medical training. It just needs time many a times. So yes, so that is one thing. And then medically, yes, you should do whatever is possible. That is, there is a pain ladder which we use. So whenever there's a pain ladder, you start with certain non-opioid medications, easily available medications. which can go up to a certain dose, and you keep increasing the dose. If that is not working, okay, that means you should go for higher medication. Again, you will start from the lowest dose, then you climb the dose higher. When oral medications are not working, you want to try with IV medications. All those aspects medically the doctor has to address, or the medical team has to address, no doubt about it. Now, despite of all of this not working, okay, all of this is not working, then perhaps you have to look at, okay, is there a psychiatric element to it? There are situations where the person has psychological illness which needs help from a psychiatrist, but only after you have ruled out or you have excluded that are the other aspects of pain.
Sir, coming to the neuropathic pain,
Yes, please, Sister Ji, please tell. Continue.
Sir, coming to the neuropathic pain, is numbness also will comes under neuropathic pain, sir? Numbness is also is one type of pain, or is it
Yes,
considered as
yes.
one sensation?
Numbness is also considered as a pain. So whenever we say that there is, the person may describe it as numbness kind of pain, or what kind of discomfort. You can ask, if pain is not there, what kind of discomfort you feel? They will say numbness, tingling, something like that. It may sound vague, but that is also considered as neuropathic pain.
Neuropathic pain.
Yes.
Okay. Thank you, sir.
So we have a question on the chat box. A GCS 6 out of 15, will it feel pain? Glasgow coma scale. Below 8 means it is a coma. The person is in coma. In such patients also, how does the doctor assess? Tell me, Sister Leela Kanti. So usually, what do doctors do when they come to the ICUs when such patients are there?
Yeah, they with needle pricks and things like that, they check the
Exactly.
pain.
Yeah, they give a stimulus, either rubbing on the sternum or putting pressure over a bony prominence, or pricking with something like these kind of things. Yes, there may be certain, like we said, non-verbal clues which is there, like they may make a facial expression change, or they may make some sounds. And especially people in ICUs and all, when all the monitors are hooked up, when you give some stimulation to them, the heart rate may go up. These are all ways in which it may be an indication that the person is in pain. Brother Michael, when I asked you to unmute, you didn't unmute yourself, but you're asking a question now. Since pain is what the patient describes, does we mean in palliative care we don't believe in addiction to certain drugs? Brother, to be frank, addiction is definitely, yes, it is one of our concerns, but it is the last of our concerns. One of the last few things which we are bothered about, because with judicious use of medication, with proper titration of doses, addiction is something which we are not worried about. We can always titrate, see if the person is developing some dependency, and reduce the dose and switch the medication to something else. It is possible. It is definitely, yes, there are people who have addiction, but the percentages of people who get addicted are far minuscule than people who benefit from it. So am I personally bothered about addiction? Absolutely not. If a person comes in pain, my intention is just to give a good night's sleep to that person without having to worry about anything else. Rest everything comes secondary, because rest everything can be managed. Painkillers are not good for the body. How good it is to give them the painkillers. So Sister Ji, painkillers are not good for the body. Okay, is sugar good for your body? I'm asking, seriously, I'm asking, is sugar good for your body? So all I'm trying to say is, there is a saying, right? Amritam adhigamayal vesham. Like that means that even if it is nectar or sweetness, which it is there, but if it becomes too much, then it is bad for your system. Here also we apply the same logic. Painkillers are good wherever in the doses it is required, to the extent it is required. But if you take too much of it, it is going to be a problem. So this is where medical training comes in, right? That you need to adjust the dosage and everything in such a way that you give it for the minimum dosage required, minimum possible time required, and only to the extent it is required. Don't do anything in excess. Even if good things you do in excess, it's going to become a problem in life. So I think we have another 20 minutes. We'll go on for the case presentation first. We have somebody amongst you who will be presenting a case. After that, we will look into further questions. Yes, Sister Harita, are you online?
Yes, sir.
All right, Sister Ji, handing over to you.
Good evening, sir. Good evening, everyone.
Good evening, Sister Ji. Please carry.
Today, I am going to present the case, which is 33 years old female, sir. Diagnosed with the central neurocytoma with hydrocephalus. Silence. Sorry, sir.
No,
My
that's
daughter
okay,
is
Sister Ji.
disturbing.
This is the symbol of, this is a symbol of commitment for me. It's absolutely wonderful that, despite of having family commitments, you're doing this. It's wonderful to know, and I'm sure each and every one of you have these circumstances around you and still have to do what you need to do and what you got to do. Please carry on, Sister Ji.
Yeah. And she diagnosed with the central neurocytoma with hydrocephalus.
So we can hear you, Sister Ji, but if you're all alone with the baby, then I think it's okay if you take care of her till she, yeah, that is also perfectly fine.
She underwent to the surgery, sir. So that is left lateral craniotomy and transcortical decompression of left lateral ventricle and then neurocytoma. And date of surgery is 3/11/2022, sir.
All right, next slide.
Next slide, please.
Yeah.
Patient having present complaints are patient is suffering with headache since 1 month, sir. And multiple episodes of vomiting since 1 month. And then history of illness, she was normal before 1 month and she started having halocranial. Halocranial means the headache that affects the entire head instead of just one side, not one side. So dull aching, headache, and initially it was mild in intensity. So one day morning after she woke up, she had severe headache associated with the blurring of vision, and the multiple episodes of vomiting and headache is persistent. And the patient were gone through these examinations. Patient well nourished, well built and nourished, and temperature was 98.2 Fahrenheit, and then heart rate is 80 beats per minute, and then BP 120 by 90 mm of Hg, then respiratory rate is 18 per minute. All systems are within normal level. And then treatment and significant investigations are MRI brain, and then T2 hyperintensive heterogeneous intraventricular lesions with area of hypointensities in the bilateral lateral ventricle of reaching foramen of Monroe. And the next patient is on features medications. Patient is on these medications tablet Levipil 750 mg BD. So Levipil used in that epileptic seizures, and then injection mannitol 20% 100 ml IV TID, tablet Dexa 4 mg OD, tab Dynapar 75 mg BD, and tab Panta 40 mg BD. It is used in anti-acidic and psychological issues are she studied GNM, sir, and working as a staff nurse. After marriage, she stopped working, sir. And then she is a mother of one child and 3 years old baby. husband expired and currently is taken care of by her sister, sir, and they are worried about anxious conditions, whether she will be normal as earlier, and then concerned about the financial issues. And the next slide. Main concerns are acute pain related to disease conditions and fear and anxiety related to the surgical interventions, and the concern about the reoccurrence of, again, central nervous cytopenia. Summary: central neurocytoma with hydrocephalus, and the surgical treatment was left frontal craniotomy and transcortical decompression of left lateral ventricle and neurocytoma. And discussion points are: it's a benign tumor, whether palliative care is required or not. We have, and as she is having a lot of pain, fear, and anxiety regarding her condition, what can be done to address these issues? And what are the role of family members in this particular case?
All right, Sister Ji, thank you so much for that presentation. Sister Ji, where are
Thank
you
you, sir.
located? Where are you right now?
I'm in Bangalore,
Which
sir. I'm
Bangalore.
not right now. I'm not working, sir. I'm homemaker.
Okay,
So I
okay,
tried
good.
to.
That's okay. That's not a problem.
Present.
Sinia, can we come back to the, just come back one slide?
Okay.
Come back to the psychosocial slide, please. Right. So here you have a person who was a nurse, who was working as a staff nurse.
Okay.
Unfortunately, I mean, at least I look at it as unfortunately, marriage becomes a reason for many people to stop working. Many a times the, you know, the better half will tell, don't go for work. Very common in places like India, in a country like India. A mother of a 3-year-old baby, husband expired. Sister Ji, was there what was the reason the husband expired? Was that explored? Do we know the reason why? How? You're muted, Sister Ji. Just unmute yourself and yeah.
The accidentally it happened. Accident, sir.
Accident. Okay, okay. So very unfortunate set of event. Her husband died in an accident. Currently, she's being taken care of by her sister.
Yes.
The family is concerned, whether worried and anxious about her condition, whether she will be normal like before. And of course, financial constraints. Now with a 3-year-old baby who is just starting, life has just started for the next generation. She is currently not working. So how are they going to address these issues? Sinia, come to the summary slide. So henceforth, when we present, like, you know, as we go forward, when we are asking, when somebody asks you to summarize, right? Can you summarize a person just by their disease? I'm just asking. Can you summarize a person just by their disease? No, right? So in this summary, you are going to say that this is a person with certain illness, with a certain symptom, who has social issues, or whose husband passed away. You can be a little specific also.
Okay.
And you summarize the life situation of that person in such a way that in that 5 to 6 lines, you know everything. You get a general picture of the person. Here we are getting a picture only about the disease. So the only thing which I can make out from this summary is what the disease is and what treatment may be needed. But I am not able to address this person's total pain, right? Okay. So this is why psychosocial issues become important. Now I want to address the total pain. Of course, now this is a case where, this is a situation where there has been a brain tumor, a certain kind of brain tumor. None of us are experts in it, including me. We will need the help of a neurosurgeon. So we need to work in collaboration with a neurosurgeon, right? So there are elements which only he will be able to do, which you said. He has undergone some some sort of a surgical procedure. But the other aspects are where we may be able to support. Can somebody else come, unmute yourself and say that what is it that you want to do for this person? You can unmute yourself. Feel free to unmute yourself. Others can feel free to put on the chat box also. What is it that you want to address in this person? For this person. This person has come to care, come to you for care. You can't say that, okay, I can't do anything. Okay. And certainly with learning palliative care and principles, you can do a lot of things. So what is coming to your mind at this point of time? How can you help out this person? Leaving legacy. Sister Ji, would you like to elaborate? Can you unmute yourself and elaborate by what you mean by that? Leaving legacy to the 3-year-old child.
Because this disease will not be able to, I think it's only for palliative management. So if let's say she died, then there's no legacy left to this small boy. Perhaps he will not know, boy or girl. So perhaps this child will not know who is the mother, and then I think it is needed for this small child to actually keep remember who is the mother, and then what are the important aspects in life that mother wants this child to know, for this child to grow and then bring on for the adulthood.
Okay, so now we are assuming that this person is going to die. Okay, it is required in many situations. But do you want to talk to the doctor first and find out what is the prognosis? Prognosis means how this person may likely proceed, right? Do you want to do that, Sister Nurul? Yeah, so we just want to know that what is the chances of this person recovering? If yes, how long? If no, how bad? These are things which we need to explore for the patient, because maybe the patient doesn't have the guts to actually find out the answers to this. We don't know. We are not sure. We need to talk and find out these things, right? So that, like you said, extremely important. Just because, there is a saying, ignorance is bliss. That's what they say. Ignorance, if you don't know about something, it is bliss. But tell me, if you just remain ignorant about this person in their situation, and if the person is having a poor prognosis, that means, like you said, she may die soon. Can we do all this planning for her child? Can we do all this planning for the future of that child? So this is where ignorance need not always be bliss, but there are certain situations, even though it is tough, we need to explore. So these are also things which we'll be coming across in the future, where the patient wants to know how bad they are or how good they are, or they may wish to plan for the future. They know now they have only 1 month remaining. For example, I'm just giving an example. Suppose this person comes to know this person has only 1 month remaining. The doctor has given an estimate, like in many cancer situations. Now you can help her to plan the remaining 1 month, right? Okay, what is it that is most important to you? I want all of you to put yourself in this position. Just imagine we all have just 1 month to live. We really don't know when we may die. I mean, death is a very common topic of discussion in palliative care world. Okay, and very frankly speaking, we don't know when we may die. Let us say we have 1 month left. Now this remaining 30 or 31 days, what is it that I want to do? How is it that I want to spend my time? Whom do I want to spend it with? What are the various aspects of my life which is going to change? These are all things which you can do for a patient. These are all things which you can expose the patient, so that it is not necessary that the remaining 30 days has to go in a bad way, but you may help the person to do whatever the person would have wished to do in those 30 days, right? So definitely, yes, this is something which we have to explore. Sister Anita is saying give psychological support. Absolutely, yes, it is a major element in this person also. You may have to explore the person, see at what level they are at, and then see what is being of concern to them, and then make solutions for them. Like I said, in the case of Mr. A, we have a certain group of volunteers. They have certain people they know who are willing to pay for the children's education. And once we told the person that, your child's education is taken care of till the time the child finishes college education, a lot of the person's physical pain reduced, because there is one major chunk of his concern which is taken care of, right? So giving psychological support, finding solutions. Yes, Sister Sujita, you have unmuted yourself.
First of all, we need to provide that confidence and satisfaction to the patient about her child's future. So once we will give that confidence to her, she may die peacefully. I'm thinking so about her. She won't get any worry and tensions about her child's future, because only one thing is her child to her now. What's about her future if she will die? So while she is dying, we need to settle everything by seeing with her own eyes. We need to give any orphan homes or some relatives who is taking care about that child's future. Everything
Yes,
will
Sister
settle
Ji.
means she may die peacefully. I am thinking so, sir.
So definitely, yes, we don't want to give anybody empty promises. But yes, we
Yes,
need to
yes.
have mechanisms in place. This is where, like we had mentioned earlier, collaborating with people, either in an official capacity or in an unofficial capacity. Many a times I call up my college friends for a patient to do something. It may be medical, it may be non-medical. Many a times we depend on connections, networking like that. So we need to have certain mechanisms like that in place where certain things can be taken up. And then you just not just say, don't worry, everything will be fine, but you show the person also that, see, there is this is the person, he is willing to come and talk to you. He will take care of your children, or he will take care of certain other aspects, something like that. This needs to be explored and done for the person in that how much ever time they have remaining. Sister Nurul, yes, exploration about what is important for the patient at the moment, any unfinished business. This is something extremely important. Before we assume anything, we may have our own idea what needs to be done for a patient, but always ask them, what is it that you want to do? Is there something which is pressing in your mind? Is there something which you want to do, share, or something which you have to explore with the person? They may not always open up to a doctor, especially because doctors many a time come with their white coats, with the stet around the neck, and then they are standing in front of the patient, looking down, looking at the file. In between, they'll get a phone call from somewhere else. This is not the scenario in which a person will open up. Especially in such situations, it is always the nurses who are there, for much more available to the patients. Yes, Sister Nurul, never be judgmental. So don't judge the patient in any way. Just like how you are in school, when you are a child, you're always looking to learn. There is no judgment or conclusion in your mind. Anything you see, you are just looking at it and you're learning. Just like that. Look at the patient, listen to the patient actively, not passively. Always listen to understand, not to respond. There is this saying, right, that people these days listen to react, not to understand. Same way, just be an active listener. They will open up to you in a way that many a times our partners don't open up to us. This is the truth. So give that time to the patient. I'm very sure that at the end of the day, you will have so much satisfaction with the job which you're doing. Yes, Sister Sangeeta, making a comfortable environment. So any comments which anybody wants to make? I think we are at the end of our session. It's 4:31. We are 1 minute overshot. All of you, your time is valuable. So tell me right now, if you want want any comments which you have, any thoughts which you have. Today we have explored another dimension of palliative care. You can either unmute yourself or you can use the chat box.
Doctor, there was a question in the chat box by Sansan. May I know is cannabis will be used in India legally? Does it have any? Yes.
Yeah, so cannabis, cannabis oil right now, certain types of cannabis in the medicated form can be used if you have a valid prescription and you need to buy it from a licensed person. But however, the stigma around cannabis is still a lot in a country like India, but there is a lot of discrepancy. In my state right now, there is a drive against cannabis which is going on and other forms of drugs. But in certain states in the northern India, it is freely available on the streets. But that is, we are talking about illegal stuff. But the medication wise, yes, if you have a prescription and if you know a person who has license for it, we can use cannabis. Personally, I am not aware of how to use cannabis as a medication oil. I mean, I've heard of doctors using it, but in our settings, because of legal issues which may happen, and there is still a lot of loopholes in this as far as cannabis is concerned. So in our settings, we don't use it. I also don't have any experience of using it for patients. So I can't comment on any drug interaction which would have happened or which may happen. I'm not sure of it. Sinia, any other questions which I missed?
No, sir, no.
Okay, Sister Ashwati has asked whether any tool is assess all these needs together. Yes, Sister Ji. So this tool is something which you have to create. Okay, there are many elements which you can bring in together and you can design your own tool. So you can bring in numerical rating, you can bring in a body map, you can bring in a table having PQ, PPQ, RSS, TU. So you can have different formats for your own self. Okay, various smaller elements may be brought together to build a comprehensive tool. So many of the centers which we have, they all have their own method of assessment tool, but it will usually be one element of something combined with another element of something, like that 4 or 5 elements which have been brought together. That is how it will be usually. Right, I think then it is time. It's 4:34. So thank you all for being active participants. Thank you, Sister Harita. I mean, salute to your, I mean, the spirit of motherhood as well as the spirit of participation. I respect all women in this way, you know, like it's amazing that the roles you have to assume to ensure that things run smoothly.
I want
It's
to share
wonderful.
something that before I was scared before I presented. This is the first time I'm presenting my presentations in online. Thank you very much, sir, for supporting.
Wonderful, wonderful. So use these sessions as an opportunity to do things which you have not been able to do. Learn things which you have not been able to learn. Ask questions. Feel free to make a fool of yourself. Feel free to make a fool of us also, because it's only when you ask questions that I will also try learning something new and bringing it out again. So it is for my growth as well. So just feel free to learn, and and I hope all of you take things of value from the sessions which is going to happen in the future as well. And feel free to connect with us anytime. Anything which you need, with any confusions which you have, dilemmas which you have with patients. Sister Srijana Sharma is showing her kid who is on this thing. Wonderful. So feel free to communicate officially and unofficially as well. I believe there is a WhatsApp group also for you. So whatever queries you have, let's all learn together and grow together. On that note, thank you so much, everyone, and we'll stay in touch.
Okay, sir.
Thank you.
Thank you very much, sir.
Thank you so much, Dr. Deepak, for joining us today. Thank you so much for your valuable time, and you made the session wonderful yourself. Thank you so much. And thank you all for joining us. And I have shared the feedback link with you all. Please kindly submit it. And kindly keep your videos on while you are on the session. Thank you all for joining us. Bye-bye.
Thank you, ma'am.
Ma'am. Thank you. Thank you, ma'am.